Good afternoon. Hope all of you are having a nice Saturday, maybe outside getting some fresh air and enjoying the day. I'll go ahead and give you a report today on our numbers, and they do keep going up. Today in Georgia, we have 2,366 confirmed cases. That's up 365 people in 24 hours since yesterday. That's a lot. We have 1 in Catoosa, 1 in Chattooga, 6 in Whitfield, 27 in Floyd, 14 in Gordon, 116 in Bartow, and we also, we have 69 deaths. That's up from 64 yesterday. That's 5 deaths total in 24 hours, and it seems like that number, every other day just keeps increasing. In Tennessee, we have 1,203. That's 1,203 confirmed cases. That was 957 yesterday, so that's up 206 from yesterday in Tennessee. Have 32 in Hamilton County, 2 in Marion, 1 in Grundy, and 6 in Bradley. In Alabama, they have 644 confirmed cases. That's up from 583 yesterday. So their numbers keep going up too. Have 5 in Jackson County, have 1 death in Jackson, 4 in DeKalb. That's up 1 from yesterday. So people, we're still in this thing. A lot of people, some people are kind of getting laxed a little bit after talking to some people this morning. They were doing different things that kind of and putting it in the back of their mind. And we're just now getting into this thing. So take it serious. Alex will not be with us today, and this is kind of a situation that happened this morning. I've actually been mowing grass this morning, and I got a call from one of our deputies, Deputy Barrett, and he and Deputy Rayleigh was on their way down to Rising Pond to a MAPCO station there on the interstate. And these people, they got a call from a person that just came out, and they were disinfecting the inside of their store for the virus using some unleaded gas. And they said, and when we actually went in, of course, we shut the store down right now, and they've got a cleaning company coming in. It'll take probably 24 hours, I guess, to go in and clean this store. But I don't know how they came up with this. I don't know. They said the guy that was running it said that the management in Atlanta told him to do that. So anyway, use common sense. Don't on this. You don't use unleaded gas for anything like that anyway. But right now, Alex is down there waiting on people from the Department of Agriculture to come in, and also the EPD's been on the phone with them. So he'll be back with us probably tomorrow. But also, I do want to thank Barrett and Rayleigh for handling that, because then also we got Matt Hill with our chief of our fire department down there. He's been on the scene most of the morning too. I've been having still questions come in, people that wanting to know the signs. You keep hearing that. How do I know? When do I actually call the doctor? Number one, if you've got a dry cough, if you've got a fever, shortness of breath, and I mentioned yesterday, some people are they're losing their taste and smell. But if you don't have a primary doctor, first thing, call your primary doctor. That's your family doctor, and he will direct you. Exactly what to do. He will check your symptoms, listen to them, and he's actually the only one right now that can order this. That can order you to be tested. And there are a lot more sites now than there were last week at this time. So there's several sites that you can go to. If you do not have a primary health care, that's another question. I've had several people that weren't tuned in yesterday that's asked this morning about this, and that don't have a family doctor. Call the health department. We've got all this number and these sites on our website, and Evan runs this thing several times a day. I'll call my number. I'll get you the number to our hotline number and they will guide you and tell you what to do and who to contact. So if you do have symptoms, you got to remember too. This is Bradford pear season. This is hay fever season, you know, and some people run fever with that. And also, we're still in, according to our doctors yesterday that we met with at the Memorial, we're still in the flu season. And this has a lot of characters of the flu, you know. So, you know, just, you know, don't panic if you do get a flu, get a dry cough, but don't do anything. Don't sit there and do anything about it either. You know, call your doctor. Let's see here. Other questions are, you know, and some people evidently didn't watch yesterday or the day before, but you know, they're saying, can we go outside? They're still, a lot of these are from not just elderly people, but people, you know, middle-aged people, and I've had 2 calls last night and one this morning about it, and they were just panicky about even, you know, going out today. Yes, you can enjoy the outside. Open your windows. You know, you can go down to the park, walk. Just don't congregate. Don't let your children on we got our playground, you know, closed down with the swings and all that, because you don't want that. You don't want them touching different objects, you know, that may not be sanitary, or you don't want them actually, you know, congregating with other children. But yeah, go enjoy your park. You know, that's something that you need to do, because this is, you know, being confined in a room is a whole lot worse than being outside and getting, you know, fresh air. Had a question, you know, are you, well, I had a couple of people ask, are you thinking about closing down the county to visitors? Well, no, not at this time. I mean, you know, we hope it does not come to that. Now, there is some counties that I did see this morning that are actually advising visitors to stay away. You know, Blue Ridge, Georgia is one of them, and they're very direct at this, you know, and they're even telling people openly that, you know, if you actually are from out of state and you have your summer homes here, stay home. You know, and I mean, even they're bluntly, you know, a couple of their government people even said, we don't want you here. Stay home, you know, and you know, and try to go through this at home and not here. So no, we're not saying that at all. Our state park is still open. Governor Kemp, from what I understand, is not planning on closing there unless it's just a necessity, closing any of our state parks. I'm not sure now about the actual housing. I understood yesterday that possibly they may be canceling some of the, they've got some yurts out there, they call them, and some cabins. And but you know, there's a possibility that in the future they may, you know, shut that part of it down. But as far as open camping and of course non-congregating, you know, congregating with people, but that's still open, and it's still open to go out and walk and you know, enjoy the fresh air. Another question, which, you know, I get this asked every day practically, but we do not have any confirmed cases in Dade County. I mean, that's coming from our health officials in the state, and thank goodness for that. That's not to say that there's not any. We don't know. I mean, you know, there's people that's been tested. We know of 6 people for sure that's been tested, and I said yesterday that one of those have come back negative, and that's great. And hopefully, you know, either today or tomorrow, we'll hear from the other people. But you know, as we learned yesterday from our meeting with Memorial and the people in Catoosa that we went to, you know, if you're tested and say you live in Dade County and you work in Chattanooga, and say you're tested and it comes back positive, okay, you're going to be notified almost immediately, our health department, and that happens. But if you work here and you live in Cleveland or live in DeKalb County even, those test results will go back to that county of origin of where you live. You know, whatever your identification says, what your real address is. And so, you know, it will take us a little longer to get that information, from what I understand, because there's not a direct, you know, contact, and especially if that employer goes to a private group to have it tested. Now, if it comes to a state health department and it goes to a state health department and one of their testing sites, that's different. They almost immediately. But if it's actually to a private group, which Memorial would be considered that, and Erlanger, you know, that is you know, they have their own sites, you know, their own people doing testing. So there is a little delay there, but not a lot. So just bear with us on that. But we'll, you know, as soon as that's why we're doing these every day. You know, just to keep you informed on exactly what's going on and what's what. Let's see if I've got anything else really that we need to And that's exactly why, we're just asking people to partner with us, I mean, and it's been great so far. People have really worked real well with us. I can't say how much I appreciate, people that work with us, because as you know, our building here, we're at work every day. We come to work. We have the pass-through windows out here for the tag office, and also we have a pass-through window for our offices, the assessor's office, and I'll also have that at the courthouse. And that seems to be going smooth too with our judges and our court system and our DA. So just work with us on this, and we'll get through it. It's hopefully this will pass through, in a few weeks, and we'll be going on with our business as usual. But right now, it don't look like it, and I'll just tell you the truth about it. We're just now getting in this thing, especially when you see numbers increasing like they have in the last few days or the last week. Carrie's got a few things she wants to say to you, but my contact number as always is 423-667-8999. It's on our website. All of our commissioners' numbers are on our website, and we're here to serve you as public servants, and just call us. And if there's any way, I don't care what time, if there's anything we can do for you, you know that we're here for you. And I'll see you back here tomorrow at 3 o'clock, and hopefully we'll have some good news. Carrie?
As earlier today, as Ted and I were going over the talking points, Commissioner Rumley and I were talking about the gracious attitude of the people of Dade County, and we wanted to take this opportunity to thank you for your kind words and your encouragement to each other, and your support of each other, and especially to us and our staff here. As you know, this has been a tremendous time of change and adjustment, and you have been very gracious to us as we try to adapt to our new way of operating. So thank you for partnering with us as we all work together to keep COVID-19 out of Dade County and to keep all of our people safe and well. We will see you tomorrow at 3 o'clock. Thank you so much for joining us.